Previously on the OT, Becky gets hit by a truck.
And that person is walking, that girl is walking, the bus is not slowing down!
Now Becky is on the road to recovery.
California, here we come, right back where we started from. California. Here we come.
Excuse me, hi! Can you give me a minute, please? Okay, I don't have that much time. Okay. Oh my god, see the Hollywood sign from here? Is it, like, how far is it? Hi! Oh, hi. Hi, my name is Stephanie. What can I help you out with today? I need some meds. Okay. My doctor sent me to the pharmacy. Okay. And what is your name? Sorry. My name's Becky. Becky, okay, what's your doctor's name? I was like a friend that movie or show with like doctors. He ended up dying like a couple months ago, and they killed him off, so I stopped watching the show. Oh, Dr. Shepherd. Yeah, Dr. Shepherd. Okay, Becky, let me check in the back for you, and then I'll go ahead and bring it out. Okay? Okay. So all these medications here are actually what your doctor prescribed for you. Oh my gosh. I brought this bag out for you, and I'm gonna go ahead and put it in there for you. Okay? Sure. Okay. I'm just gonna get out of here and I'll figure it out. Okay, well, if you need any help with your medication, please feel free to come back, okay? Okay, yeah. Thanks. Yeah. Bye. Hi, I'm back. I need help. Hi, Becky, right? Yeah, I don't know what you gave me. Oh, okay. You gave me like a B something. You gave me a PEOs. I don't. Oh my gosh. Oh, do you need help? Your pain levels are pretty high. Okay. Well, I definitely can help you out. You want to learn more about your medication, right? Yeah. Okay. Okay. So I definitely don't want you to take these medications around the same time. On the bottles are specific times. So it's like 8 a.m., 9 a.m., 10, apples 11 a.m., 12, and so on if you follow through with that. Also, I want to make sure that you're not drinking any alcohol with this. Is that going to be an issue with you drinking alcohol with any of your medications? I drink it like 3 times a day. Well, I definitely cannot have you do that. There's going to be too many side effects. Well, side effects include you might have night terrors, sleepwalking, you might actually have sleep eating, pain. What is sleep eating? I'm trying to cut some calories right now, and I only ate homegrown avocados, so I don't know what you want me to do with that. Like, can I eat whatever I want? Well, you know what? The doctor told me to meet up with an OT. There's just like occupational what are they? Therapy? Occupational therapy? Yeah, I don't need a job or anything, but they told me to meet with them, so I don't know what she does, but maybe she can help me. Yeah, actually, occupational therapy, they do help with medicine management, so they'll be able to help you out and make sure you don't get all these big side effects. Okay? Occupational therapists help with managing medications by establishing a weekly medication schedule using a pill box to organize. Another day. Oh, pain. Hey. Oh yeah, it's Friday. Gotta take my meds. Well, do you have any other questions? Yeah, no. I'll go talk to that OT, occupational therapy. Okay, thank you. I'll just go talk to her. Okay, bye.
so my name is Katarina. I went to school at University of the Pacific. I'm currently working at Kaiser Permanente as an outpatient pharmacist. At Kaiser, my daily routines generally include consultations, so letting patients know how to take their medication, side effects, adverse reactions, as well as data verification. So that would be like checking over prescriptions, making sure that they're valid, making sure that the doctor prescribed the correct dose, the correct way to take it, any questions that we may have to call them, discuss it with them, and have them change it. And we also do product verification, which is just making sure that prescriptions are filled correctly. Pharmacists work with insurance companies. Some pharmacists work in long-term care settings, which is kind of, overseeing hospice, nursing homes, things like that. Pharmacists also work in AM care settings, which is kind of like an outpatient diabetes clinic, hypertension clinic. So patients will come in and you'll see them on a regular basis. They work in outpatient settings, like when patients are discharged from the hospital, they'll come to that pharmacy. We also work in retail settings, which is just like your Walgreens, CVS. Pharmacists in AM care, which is ambulatory care, they do go out to see patients at their houses just to go over, to make sure that they're taking the medications correctly, check over their cassettes or, make sure that they're not having any issues taking it. So definitely pharmacists do go to their homes. So scope of practice, I guess, for pharmacists includes things like being able to do health and wellness testing. So things like that would include maybe like blood pressure measurements, and also just helping them manage chronic diseases like hypertension, hyperlipidemia, diabetes as well. Sometimes they come to us with like medical equipment, different sort of splints or like different bands that they can put around like their arm to help support it, things like that.
Or orthotics.
Yeah, exactly. I don't have as much knowledge about, and in that case, it would be, important to refer them to an OT. You could do medication management just about in every setting. So there's a few different types of pharmacy. Like in a retail setting, there's definitely medication therapy management as well, in which you make phone calls to the patient and reach out to them depending on, I guess you'll look and see patients who are taking like 10 different medications, and you'll look at like, okay, like are they picking them up regularly? Maybe there's some sort of underlying issue. Maybe they're not able to pick up their medication. Is it that they can't afford their medication? And you'll make those sort of outreach calls to them. I guess in an outpatient hospital setting, what we do there is that during our consultations, we kind of we flag those patients as well and kind of speak to them in person about it. And there are also pharmacists in more inpatient settings that before a patient is discharged from the hospital, they go up to their rooms, talk to them, in particular to make sure they're not having any issues with their meds. I guess in an outpatient hospital setting, what we do there is that during our consultations, we kind of we flag those patients as well and kind of speak to them in person about it. And there are also pharmacists in more inpatient settings that before a patient is discharged from the hospital, they go up to their rooms, talk to them, in particular to make sure they're not having any issues with their meds. The NAPLEX. And so that exam, basically, I think it's over 4 hours long, and that's what we have to take to be able to practice. And then each state actually also has its own law exam. So I also had to take this exam called CPJE, which is kind of a California law exam. And then if you want to practice in another state, you have to take another exam per state. Every 2 years you have to renew your license. I just feel like the whole, commitment to patients and being able to help assist patients with their access to access and information to medications is kind of similar to OT, as well as just medication management and helping them, incorporate it into their daily lives.
Find the most attractive OTs in the area, only on OT Ender. It's where love actually happens. Now on Instagram,